Have you ever wondered why your joints ache as you age? Could it be due to osteoarthritis? Welcome to our exploration of this common yet often misunderstood condition. Osteoarthritis, also known as degenerative joint disease, is a type of arthritis marked by the breakdown and eventual loss of the cartilage in one or more joints. It's like the wear and tear that happens to your favorite pair of shoes, except it's your joints that are wearing out. Prevalence of osteoarthritis is significant. It's estimated that over 200 million people worldwide are affected by this condition, making it one of the leading causes of disability. In fact, in the United States alone, more than 30 million adults are living with osteoarthritis. It's a silent enemy, often creeping up unnoticed until the damage is considerable. The importance of understanding osteoarthritis cannot be overstated. It's not merely an old person's ailment. It can strike at any age, and its effects are not just physical. The pain and loss of function can lead to depression and a lower quality of life, but there is hope. With the right knowledge, we can combat osteoarthritis. We can learn to recognize its early signs, seek timely medical attention, and adopt lifestyle changes that may slow its progression. For many of us, osteoarthritis is a mystery. We know it has something to do with our joints, but what exactly is happening? How does it start? Why does it cause so much pain? And most importantly, what can we do about it? These are the questions we aim to answer as we delve into the world of osteoarthritis. We'll explore the root causes, unravel the mechanisms that lead to joint damage, and explain the available treatment options. We'll also discuss ways to prevent osteoarthritis or manage its symptoms if you already have it. So are you ready to confront this unseen enemy? To understand what's happening within your own body? Knowledge is power, and with power, we can fight back. Stay tuned as we unravel the causes of this widespread condition. So, what exactly causes osteoarthritis? Well, the primary culprit is wear and tear. Just like your favorite pair of running shoes, over time, the cartilage in your joints can wear thin. This wear and tear can lead to osteoarthritis, causing pain, swelling, and stiffness in the joints. In some cases, osteoarthritis can also be caused by an injury. A sports injury or an accident can damage the cartilage in a joint. Even after the injury has healed, this damage can increase the risk of developing osteoarthritis in that joint later on. Genetics can also play a role. Some people have a genetic predisposition that makes them more likely to develop osteoarthritis. If your parents or grandparents had osteoarthritis, you might be more likely to develop it too. As we age, the likelihood of developing osteoarthritis increases. Let's find out why. When do people generally start experiencing osteoarthritis? An intriguing question indeed. Osteoarthritis is often associated with aging, but it's not exclusively an old age disease. It typically starts to manifest in individuals around the age of 50. However, onset can occur earlier, particularly in people with certain risk factors. Genetics can play a significant role. If your parents or grandparents had osteoarthritis, you may be more likely to develop it too. Lifestyle also has a crucial impact. For instance, those with physically demanding jobs or who engage in high-impact sports may experience symptoms earlier due to increased wear and tear on their joints. Equally, being overweight can put extra strain on weight-bearing joints like the knees and hips, potentially leading to earlier onset. It's important to remember, though, that osteoarthritis can occur at any age, depending on these factors and more. Now, let's move on to the symptoms of osteoarthritis. How would you know if you're suffering from osteoarthritis? Well, the symptoms might not be immediate or apparent, but over time, a gradual onset of discomfort could signal the presence of this condition. Let's delve into the common signs and symptoms of osteoarthritis. Primarily, the most prevalent symptom is pain. It's not just any pain, but a deep, aching discomfort that worsens with activity and subsides with rest. This discomfort can become persistent, often affecting sleep patterns and daily routines. Another symptom to look out for is stiffness. It's a sensation that is most noticeable upon waking up in the morning or after a long period of inactivity. This stiffness usually lessens with movement, but it's a telltale sign that something may be amiss. Moreover, you might also experience a grating sensation or hear a crackling sound, known as crepitus, when the affected joint is used. This occurs as the smooth cartilage wears away and the rough surfaces of the bones rub against each other. Now, let's talk about the areas of the body most commonly affected by osteoarthritis. This condition primarily targets the weight-bearing joints of the body. The knees, for instance, bear the brunt of our body weight, making them highly susceptible. The hips are another common sight. As we move, sit, or stand, these joints endure a great deal of stress, leading to wear and tear over time. Don't overlook the spine either. The vertebrae and the discs in your neck and lower back might also be impacted, causing discomfort and limited movement. The small joints of the hands and fingers are also not spared. The ends of the fingers and the base of the thumb are typical locations where osteoarthritis can take hold. Remember, osteoarthritis is a progressive disease. The symptoms develop slowly and worsen over time. If you're experiencing any of these symptoms, it's crucial not to ignore them. Diagnosing osteoarthritis is the next step after recognizing the symptoms. How do doctors diagnose osteoarthritis, and how can it be treated? These are the questions we are going to address in this segment. When it comes to diagnosing osteoarthritis, the process is multifold. Initially, your doctor will carry out a physical examination, looking for common signs like tenderness, swelling, or redness. They will also check your range of motion and listen for any cracking or grating sounds. If osteoarthritis is suspected, your doctor may suggest further testing. This could involve blood tests to rule out other conditions, or imaging tests like X-rays and MRI scans to get a detailed look at your joints. Sometimes, a joint fluid analysis might be conducted to identify the cause of joint swelling and pain. Now let's move on to the treatment. There's no definitive cure for osteoarthritis, but the goal of treatment is to manage symptoms and improve quality of life. Lifestyle changes are often the first line of treatment. This includes regular exercise to strengthen the muscles around the affected joint, maintaining a healthy weight to reduce stress on your joints, and using assistive devices if needed, like canes or walkers. Medication can also play a role in managing osteoarthritis. Over-the-counter pain relievers and anti-inflammatory drugs can help manage the pain. In more severe cases, your doctor might recommend prescription drugs or even corticosteroid injections. However, in instances where conservative treatments aren't effective, surgery might be considered. This could be arthroscopy, joint replacement, or joint fusion, depending on the severity and location of the osteoarthritis. Remember, every patient is unique, and the treatment plan is tailored to fit the individual's needs, symptoms, and lifestyle. It's essential to have open discussions with your healthcare provider to understand the best path forward for you. Prevention, however, is better than cure. So, in the next segment, we'll discuss some key prevention strategies and summarize the key points we've covered today. Stay tuned. How can you prevent osteoarthritis? Let's recap the key points we've learned. Preventing osteoarthritis is not always possible, but there are measures you can take to reduce your risk. Leading a healthy lifestyle is paramount. Regular exercise strengthens the muscles around the joints, reducing strain. It's crucial to focus on low-impact activities though, such as swimming or cycling, which are kinder to your joints than high-impact sports. Maintaining a healthy weight is another preventive measure. Excess weight puts additional stress on weight-bearing joints like the knees and hips, increasing the risk of osteoarthritis. A balanced diet, rich in fruits, vegetables, lean proteins, and whole grains, can help manage your weight and ensure your body gets the nutrients it needs for overall joint health. Next, let's consider occupational hazards. If your job involves repetitive stress on certain joints, it's critical to take regular breaks, use protective equipment, and employ proper techniques to minimize the risk of joint damage. Now, let's revisit the key points we've discussed. Osteoarthritis, the unseen enemy, is a degenerative joint disease, often resulting from wear and tear. The root cause is the breakdown of cartilage, the smooth cushioning tissue at the ends of bones. While osteoarthritis can occur at any age, it's most common in people over the age of 65. Symptoms vary but commonly include joint pain, stiffness, and a loss of flexibility, particularly in the knees, hips, and hands. Diagnosis typically involves a physical examination and imaging tests, while treatment focuses on managing symptoms and improving joint function. This can involve a combination of medication, physical therapy, lifestyle changes, and in severe cases, surgery. In summary, osteoarthritis is a complex condition, but understanding its causes, symptoms, and treatment options can empower you to manage it effectively. Prevention strategies like regular exercise, maintaining a healthy weight, and being mindful of occupational risks can help you protect your joints and live a healthier, more active life. Remember, understanding osteoarthritis is the first step towards managing it. Stay healthy and informed.